this video for educational purpose and on internet.
Yes.
Tell me about your pain and your life before the surgery.
Well, I was born and raised on a farm.
Okay.
As young men, I had two brothers. We had 250 head of cattle, and in the summertime we would make hay, including alfalfa, and we would bale it, and those bales usually weighed around 125 pounds. We'd have to go into the field with a hay rack to stack them on the rack, bring them home, and then build a haystack. That's where I'm sure that 90% of my problems.
So you had a rough childhood and
Yes.
youth.
Yes.
So you had lots of back pain. Tell me about it just before the surgery.
Pardon?
Before the surgery, you had lots of back pain. Tell me about
I
it.
had a lot of back pain.
Tell me about it.
Well, there's nothing I could do. I go to the chiropractor, but they can all. In fact, the chiropractor that I go to now, he's probably been a chiropractor for 50, 60 years. And when I started, we've lived here in Minneapolis for 60 years.
Yeah.
And at one point he said, "Wyman, I can't help you anymore." So
Because you had bad pain, right?
yeah,
1 to 10, how bad was that pain?
it was bad.
8, 9, what number?
8, 9, yes.
Yeah. For how many years?
Oh, years.
Years.
So he said, "I can't do anything for you." So he sent me to a doctor in St. Cloud, and they gave me the injections. They did not help.
Yeah. So you did non-surgical treatment and it didn't help you.
Didn't help.
Did you talk to any surgeon to help you out beside me?
Well,
No names, no names.
I'm going to tell you, I have a very good friend of mine who is passed away. He was an excellent surgeon downtown Minneapolis,
Okay.
but he would not do that. So I don't know how I got your name.
Doesn't matter, but the surgery was done about a year ago, right?
The 13th of May.
Yeah, about
Yeah.
so soon to be about a year ago, and the surgery. This is the surgery what we did. This is a complex surgery, and literally, if I put this picture out there, many of my colleagues are going to say, "But the angle is not right there," and show me that picture here and there. And this is the surgery we did. The bone is beautifully growing, but I think more important than how picture look like, and many of the surgeons who would say never do this surgery and would criticize you, they never listen to you, what your symptoms are, and how are you? That's the question. How did the surgery work for you?
In fact, the chiropractor that I've gone to has since had the surgery too.
Okay.
He just got back about a month ago
Okay.
from another. He has had the back surgery,
Okay.
and he is very interested in mine. He has asked me about it many times.
Why? Because what's the reason he's interested in your surgery, that
To
chiropractor?
see how I came out,
Yeah.
since he said years ago there was nothing he could do for me anymore.
Yeah, yeah. Now, let's talk about your pain that you had before the surgery. How's that pain?
That's gone.
That's gone.
I don't, the only pain I have is the one I showed you.
Yeah, yeah. Do you have obviously some other problems that cause some pain, but that's pain that you have before the surgery, that pain is gone.
That's gone.
Okay. Now, your daily activity, comparing to what it was before the surgery, how is it? How is your daily life?
Well, if I can get rid of this, whatever this cycle, whatever it is, but my wife and I live on 8 acres. I mow lawns. I do everything.
I do everything. I love that.
I just got done. In fact, before I came down here, I blew the sidewalks off with the snow blower.
Oh wow, wow. That's
So I shovel snow. I do everything.
good. Well, that makes me very happy. So the surgery worked for you.
Yes.
And that was a surgery that it was 1.5 hours. We lost 1.5, not even half a cup of coffee of blood. and just going to check on that. But most likely you stayed just 1 night or 2 nights in the hospital.
That was all. I can't remember.
Yeah, that's a good thing. You don't want to remember that. And that is the point, that what matters is how you do after a surgery. And lots of our colleagues, they concentrate on how picture look like. This
Yeah.
picture is not perfect because you still are side bending. Your
Oh,
bone
yes.
is growing in many levels. But that is not what matters. What matters is how you are doing.
Yeah.
Thank you so much for sharing that.
You're
with me.
welcome.
Appreciate it.